So welcome to the town hall. I mean, this is part of the State Society on Aging of New York's conversation series, which is starting today and going for a month from now, so mid-October. And so my name is González-Rivera, and I have the privilege of serving as the president of SSA. We're an interdisciplinary membership organization focused on improving the lives of older New Yorkers. We were founded in 1972 as a trade association for educators in the field of gerontology. And today we continue to be a gathering place for New York's academic gerontology community. And at the same time, we've expanded our membership to include many other people who are working on behalf of older New Yorkers, including direct service professionals, researchers, advocates, students, and policymakers, and in a wide variety of disciplines, ranging from public policy and urban planning to psychology, social work, and many other areas. And our members work locally, they work statewide, nationally, and even internationally. We're also an all-volunteer organization, so we put this series of events together for you in our copious spare time. And so normally around this time, I mean, for those of you who are, normally around this time, we'd be wrapping up for our annual conference in late October, which this year was going to be held in beautiful Saratoga Springs, New York. But, and of course, nothing compares to, seeing our colleagues and friends in person at our annual conference. But what we hope to offer instead is a great series of virtual conversations with very smart and accomplished people in our field who might offer some, knowledge and inspiration in this very uncertain time. So just as a reminder, all events in the SSA Conversation Series are free and open to the public. We have 2 events, including this one, up on our website now, and we'll be adding more soon. So please check our website for more details. And of course, feel free to invite others, since we're happy to provide this as a public series of events. And also, we love new members. So if you're not yet a member, please consider joining us. You can join as an individual or as an organization, and there are discounts for older adults and students. And we keep the rates very affordable. So check the membership page on our website, which is ssany.org. This is my low-tech way of showing you, ssany.org. Membership entitles you to elect board members, just join our committees where we discuss and take action on policy issues affecting older New Yorkers, and you get a discount on our annual in-person conference, which, if we're lucky, it'll happen next year. So anyway, kicking off the SSA Conversation Series is our town hall. At our annual in-person conference, the town hall is always one of our most popular sessions. And the reason why is because every year, elected officials and other policymakers have generously agreed to take some time to speak directly to you about what government is doing around the policies that affect older New Yorkers. And this year, of course, we'll be focusing on the legislative and policy responses to the COVID-19 crisis. And joining us here on the screen are 3 policymakers and advocates for older adults who have really shifted into high gear in response to the effect of the pandemic on older adults. So starting with, well, you're all in different order on the screen, but State Senator Liz Krueger, so wait for us here. So she represents New York's District 28, which covers the Upper East Side of Manhattan and parts of East Midtown. And many of you will know, especially if you're based in the city, you'll know the roundtables for boomers and seniors that she hosts regularly in her district, which provides valuable information about a wide variety of topics. Some of you have also had the pleasure, as have I, of speaking at her fishbowl discussions, which are very informative and expertly moderated by the senator. So I hope I can moderate this discussion, at least partly as well as you do yours. So thank you so much for joining us. And Greg Olsen is the acting commissioner at NYSOFA. As such, he and his team are responsible for disbursing a large portion of the funds that support services for older adults statewide. And during the pandemic, his office has been very busy adapting the direct service regulatory infrastructure to the challenges presented by the pandemic. And last year at SSA's award ceremony, we were proud to honor Greg with an Advocate for Older Adults Award in recognition of his advocacy for older New Yorkers. So thank you for joining us, Greg.
My pleasure.
And Bob Blancato, so wait for us here. So Bob Blancato is joining us from DC, and he's the head of the Elder Justice Coalition based in DC, and also the president of his eponymous consulting firm, Matz Blancato and Associates. So Bob is a nationally recognized advocacy powerhouse who really has his finger on the pulse of legislation and policy at the federal level. During the pandemic, he's been busy ensuring that the coronavirus relief bills provide additional funds for older Americans funded services. And he's been a longtime supporter of SSA, and we look forward to his misses from DC at our annual conferences every year. So thank you once again, Bob, for joining.
My pleasure. Thank you, Christian.
And again, my name is González-Rivera, and in addition to my role at SSA, my day job is to serve as the Director of Strategic Policy Initiatives at the Brookdale Center for Healthy Aging, which is a research center of Hunter College of the City University of New York. And I see that my boss, the Executive Director, Ruth Finkelstein, is also in one of the little Zoom boxes here. So thank you for joining us as well. And I think we have some other colleagues from our office joining us. So just to get us started, I'd like to start the discussion by just asking, how older adults across the state have received information about how to live through this pandemic. Of course, we know that older adults are at greater risk for serious illness or worse if infected, and that the best precaution is often to isolate, preferably at home if possible. But this also means that older adults who were once living independently and had little or no connection to services were suddenly rendered dependent on others. So what are some stories from across the state around how older adults got access to information, the information that they need in order to adjust to pandemic life?
I guess I'll start if you don't mind. My office took very seriously the assignment of making sure we were providing as much correct information as we could about anything and everything related to COVID-19, with an emphasis on we were sharing science and facts. We were not getting into the politics of it. We sort of decided to write off the politics and just try to focus on making sure that we had good information available to people in as many ways as possible. So if you look at my website today, lizkrueger.com, you'll see a whole section on COVID-19 that goes into unbelievable detail about different resources and programs and the rules, which change constantly. So we update that multiple times per week. We were literally doing daily mailings through our e-blast system for months and months and months. I think we've gone down to maybe 3 times a week now, but we were doing updates every day, and the email list was being spread throughout, much larger than my Senate community, because anyone can sign up and there's no cost. And if it shows up in your email box and you want to delete us, we don't take it personally. We don't know, and no trees were killed. So it's an amazing way to share information if you're email accessible. We've also been doing, as you mentioned, Christian, we already had a pretty robust set of programs, particularly targeting boomers and seniors in my district, of morning meetings, and we added online town halls just like this. We've been doing them pretty much every Thursday evening. Sometimes the hour and day changes, most of which all relate to what's happening with COVID changes, and quite a few of which have been specific to seniors. Wendy Brennan from my office is on this call now, and she does amazing work for me, working with the older population as well as public events. And we've literally been just talking to people every minute of every day for months, trying to address their concerns, try to decrease their fears if we can, with facts and information that can help them. My goodness. I think we have staff. I have staff who get on every single call with the governor, the mayor, Department of Health, state and city, any agency that's announcing it's doing some kind of phone or web informational, we then send around the notes from those meetings and add those into our most up-to-date email blasts and website. So whether we intended to or not, we've sort of become information collection central for the last several months. And we get, I have to say, pretty amazing feedback of how important and valuable it is to people.
Right, great. Greg, I mean, it's like, have you been hearing any stories from across the states about how?
Yeah, I think the question's important and the response is so much bigger. But first, I want to thank you and Annette, and it's great to be here with Senator Krueger and Bob, two great advocates, and looking at all the friends on the line. I do have to point out that Jackie Berman has been on the same beach for the last 3 months, and so I wonder how I can get there. But, you know, we are a long way away from getting straight what the story is on this. I mean, you know, you see what's just come out in the newspapers over the last couple of weeks in Bob Woodward's book. But if you go back in the beginning in March, when, you know, New York State was really thinking about shutting things down, and we were trying to get good information out really at all levels through state government, which I think was on the same page, through many of the strategies that Senator Krueger talked about, trying to engage our area agencies, social media, all the community-based organizations, not only within the aging network, because this isn't an aging issue. This had to be a large-scale mobilization across New York State. But I'm going to back up and just walk through a couple of things that I think really highlight the need that we cannot stop doing this. There are still a lot of people out there that are, you know, listening to the wrong media outlets, and that's where I'm going to try to go here. So right in the beginning, AARP invited the Lieutenant Governor and I to get on a teletown hall that they had. It was the most highly participated in teletown hall they had ever had. We had 28,000 people, and this was probably in middle to the end of March. And a lot of the questions were, you know, frankly, quite scary. And this was early on, just, you know, conspiracy theories, misinformation. Over that weekend, I remember watching the news and having somebody being interviewed at a particular political party rally and talking about it's the same as the flu, nothing to worry about. And it was a Sunday. I was in the office. I have a map of the state and the counties. And it dawned on me, not that this is some revelation, but it really hit me hard, that if I'm looking at the state of New York, most of the news outlets in upstate New York, especially in the rural areas, are AM radio and conservative radio. And we had to really shift gears in terms of how we were going to get the message out to people, because I have heard, as so have you, and almost fairly recently, within the last couple of weeks, this only affects Democrats. It's a Democratic hoax. It's no different than the flu. And it's crazy to be 7 months into this in September and still have that kind of talk going on, but it is going on. So we worked with the Lieutenant Governor to literally hit the AM radio stations, and she's been doing 6, 7, 8 interviews a day, every day for about 5 or 6 months. As I mentioned, our social media, we do a live Facebook event every 2 weeks. We reach about 6,000 people, but we have to constantly keep this in front of folks, because if we're not, they're going to, revert back. And again, watching the news this morning, over the weekend, over the last week, we have a long way to go. At the same time that everybody is gearing up for a major spike in the fall from all the public health experts, what was said last night is we're rounding the corner. This is going away. Again, this isn't an older adult issue, but if we're not protecting ourselves, then we're not protecting our families, we're not protecting our community, we're not protecting our state.
Mm-hmm. Mm-hmm. So I wanted to add to that as well. So yes, I mean, it's like there's been a lot of misinformation, different people receiving different information over time. I mean, you know, Liz, I mean, it's like you've done an excellent job in getting important information out to people. But how has the messaging to older adults around COVID, how is it different now than it was in March or April? Let's say, I mean, it's like, give us a sense of how that's evolved. I mean, certainly life is more open now than it was, you know, in the depths of the lockdown, but what, if anything, are older adults being told to do differently now than before?
You know, from our perspective, I don't think there is a lot difference. So it depends on where you go. There's still a lot of fear for people going out, as there should be. So, I mean, the same protocols, you know, we've learned a lot about the virus over the months, but the fundamentals of what we need to do, they haven't changed at all. And those are the things we need to continue to talk about. Good hand hygiene, social distancing, wearing a mask, you know, trying to stay out of, you know, the recent report about, you know, bars, coffee houses, and restaurants. You know, those are places you shouldn't be going. So the messaging really hasn't changed. The message always has to be what you can do to protect yourself and what others can do to protect you. And later on in the conversation, I'll talk about a tool we're going to be launching with Bell Age and Mount Sinai over the next couple of weeks that really helps reinforce behavior and how your behavior affects your ability to get the virus, transmit it, die from it, and provide recommendations on how to improve behavior to limit that risk.
Mm-hmm. Mm-hmm.
Christian, I'd say the one thing that we see changing is that after months and months of New York City hospitals being so overwhelmed by COVID and literally terror of people to enter a hospital or a doctor's office if they weren't literally thinking they were dying of COVID, was that now the messaging is, don't forget your other health-related issues. The hospitals are not filled with COVID. They are open for business. More and more private doctors' offices are reopening for business, and making it clear that, let's be honest, older New Yorkers had disproportionately higher levels of health-related issues than younger New Yorkers pre-COVID. And during the pandemic crisis, no one was even imagining dealing with anything beyond COVID or other, you know, life and death issues with ambulances rushing you with heart attacks or strokes to hospitals. So now I think there is an effort to message to people, okay, let's not forget about just good health protocols for yourself. Let's not forget about if you were scheduled to have follow-up with doctors for specific health-related concerns for yourself that have nothing to do with COVID. There's no reason not to be continuing to get health care for yourself. Even there was a funny, I don't know, I'm sure it's not funny, but I found it a little funny. There was a story in the Times about the increase in cracked teeth and people needing to go to dentists. And the article is pretty much like, because everybody has angst and is overwhelmed with what's been going on, they are biting their teeth more when they go to sleep. You know, when you have a lot of anxiety and tension, that's coming out in grinding your teeth when you're asleep, which translates into breaking of your teeth, particularly if they're older and a bit brittle. So apparently there's a new dental crisis that correlates to this that I certainly hadn't thought about at all. But the minute I read the story, I was like, all right, what am I going to sleep with at night to make sure I don't grind my teeth and break them? Because that's a pretty lousy outcome, by the way. So everybody, don't grind your teeth.
Right. Well, yeah. So the it's interesting. I mean, it's like that. There's a lot of messaging that hasn't changed, but at the same time, we're hearing that one thing that people are hearing is that they should be tending to all of their medical needs. I mean, it's like in going back to the doctors and making sure that they're still keeping up with that. At the same time, many older New Yorkers, more than before, have turned to senior centers and other providers of services for help. Yet, of course, as we know, providers themselves, for a long time were scrambling to provide services remotely. So speaking of New York and then also across the nation, Bob, I'm thinking of you and sort of your national work. What are some of the most sort of innovative solutions from service providers that you've come across in terms of being able to reach older adults who maybe saw themselves as independent, but now are looking somewhere for help?
Well, first of all, thank you for putting this together and letting me be part of it. And like Greg, I'm seeing like a ton of friends pictures, and it's so nice to see so many of you from different places. I'm actually in a rare situation. I'm actually in my office. I'm able to work in my office in DC because I'm in a small environment, so it works out pretty well. But that being said, it's chaotic. here. I mean, you talk about message problems. I mean, this is the capital of message problems. The inconsistency from a daily basis from one floor to another within the Department of Health and Human Services alone could astound you. But you know, that's not what you really asked about. I will say that the innovations that are going on really, in my judgment, have been particularly in the nutrition area for older adults, because the judgment had to be made quickly at the local level that congregate sites had to close, yet those same people needed to be served. And there had to be another way to do it. It had to be done in a way that was seamless, had to be done in a way that would allow you to meet the needs with whatever resources you had available. And I think from an experience that I had back when they passed the first of the emergency bills, the Families First bill, you know, we got calls from members of Congress asking us specifically to go out in the field and ask folks running nutrition programs, what were they anticipating to happen? Okay? What was going to be the situation on the ground? And in light of that, what would they expect to be their resource challenges? Was it going to be more expensive to do more home delivered meals? Were you going to need more staff? Were you going to need this and that? And happily, through our different associations, National Association of Nutrition and Aging Service Programs, Meals on Wheels America, we canvassed folks. They came back with genuine stories. They may not have been empirical data reviewed studies, but they were empirical on the ground studies that could be translated into going to Congress and saying, this is the level of funding we think we need to get through the first couple of months of this crisis. And as many of you remember, the first $250 million that was passed in Families First just went to older adult nutrition programs. So, you know, we rely on the members, really, of our different associations to tell us what's going on. And then on the ground, you know, people are creating all kinds of new ways of doing telephone reassurance, doing technology reassurance. The improvement in telehealth coverage as a result of the pandemic and the administration's waiving of different rules has been very helpful as well. But there's a desperate need to make sure that contact is made and maintained between older adults themselves, whoever else they can reach. But people are being creative and innovative, and all we have to make sure, and we'll talk about this a little later, is to make sure that the federal money continues to come in.
Right, right. Greg, what have you been seeing across the state in terms of, you know, innovations in reaching older adults?
Well, you know, I think that the reason I'm in this work is exactly what I saw during this pandemic. Is you know, I see folks like Allison Nickerson and others on the line that, you know, we represent a very large, nimble, able to adjust quickly network. And to Bob's point, you know, we had in New York State under one of the executive orders, Matilda's Law, which is very strong guidance targeted at the time at people over the age of 70, people with underlying health conditions and chronic conditions, to stay home. And frankly, folks took that seriously in almost the entire state. But that created a lot of concerns, both from the capacity side and a lot of concerns in terms of what people were dealing with in their homes. So on the capacity side, you know, our network is almost entirely run by volunteers who would fall under Matilda's Law. So we were concerned that we weren't going to be able to prepare meals from the 800 plus senior center closures. We weren't going to be able to deliver them. We weren't going to be able to provide transportation to dialysis and cancer treatments. That we weren't going to be able to do that hands-on touch. But that really did not, for the most part, come to fruition. We had the state really, you know, governor says it all the time, in the worst of times, the best of New Yorkers come out, and it does. We had furloughed workers, non-essential state and local staff, teachers, college students, high school students, Girl Scouts, Boy Scouts, general volunteers, retiree groups, all pitching in a hand, as well as private businesses that really, you know, took it upon themselves to be there for their community. But, you know, to, again, Bob's point, you know, we've seen a lot of technological shifts. Those will never replace the face-to-face contact. So that what that means then is you really have to prioritize, you know, who you're able to do that for and who you're not. You have to be able to assess quickly who has additional supports. We had a 100% increase in New York State in nutrition. And obviously, it's very well known what the city had to go through in terms of the number of meals a day provided, not just to older adults, but across, you know, all the age groups. You know, as the state as a whole, we had a 100% increase. We had people taking this seriously. They couldn't get their meals. They couldn't get groceries and supplies. They couldn't get rides. Then we were combating, the impacts of social isolation. We had economic and social complete disarray, increase in anxiety, depression, abuse, child abuse, elder abuse. And so, you got to really think about how you keep those connections that Bob talked about, whether they be in person to those who are really at risk, and that was still happening, to those that you can work on a technology platform, which obviously began ramping up prior to COVID, but is now exploded. And then we have to deal with the issue of those that don't have access to broadband, those that can't afford the equipment, those that don't know how to use the equipment. And so those are all things that we're building into our assessment tool that we're going to be screening for. We have a bunch of projects in the technological front, but the future of the aging network is not going to be one of technology. It's going to be an important piece. What is great about the network is its ability to connect personally, however we define that.
Mm-hmm. And Senator, I mean, along those lines, I mean, what have you been hearing from your constituents in terms of what kinds of resources have provided comfort, engagement throughout this process? I mean, it's like we've been hearing about nutrition programs, I mean, meeting those basic needs. What have you been hearing in terms of, what people have resorted to?
So I think what I'm hearing in my district may not be what everyone's hearing everywhere else. Let's remember that my district is both disproportionately older New Yorkers for a couple of demographic reasons. So I have a large percentage older New Yorkers, but I also represent the wealthiest district in the state of New York. Although I would point out probably the lower income people in my district are the older people, that they are very often the same people. But from talking to my colleagues on a regular basis as well, statewide, it is absolutely the parallel story for older New Yorkers as this COVID story has been for everyone else. If you're Black or brown, and if you're poor, the impact has been dramatically worse. You don't have the resources. I mean, Greg pointed out, New York City did, even if there were complaints, a heroic effort to try to feed every single New Yorker who needed assistance with food on a day in, day out basis for months and months and months. I don't know any other government in the country that took on such an enormous set of responsibilities for itself. But that was just the food side of it. So, in my district, lots of my older New Yorkers may have learned about food shopping online that they may never reverse from. They may never go back to supermarkets because they are computer literate, and the extra maybe $6 or $7 for a supermarket delivery where they actually shop for you and bring it to you may be a game changer positively for them forever. Telemedicine, which was brought up. If you have computer technology, know how to use it, and have access to probably a private physician who will do telemedicine with you, I don't think that you're going back. I mean, not that you won't go see doctors, but that won't change. But again, it's money and education that correlate to whether or not you have certain access to the newer options that may in fact be with us for good reason for a long time. I mean, in New York City, I don't know how many people I guess most people on the call Zoom are, but you can now watch theater, opera, take tours of museums that aren't even open, movies from 1922 through 2020 on your computer screen 24/7. So the ability, if you've got the technology and the skill, to stay engaged in the larger world through arts and culture and news, I actually think is bigger now than it was 4 or 5 months ago. It's sort of, blown up because people have all said, well, how do we function in this new world where we are physically isolated but don't want to be mentally cut off? But if you are low income, if you are suffering from much worse levels of the actual illness in your household, in your family, without the right resources, I don't think you really have been able to take advantage of any of those things. And so there are still, I think, giant holes in what we are providing and who is getting what kind of services and resources.
You know, Christian, I want to make one point that I think is it's not so much an innovation, but something we should be concerned about, looking for innovation, which is the whole need for older adults to get flu and pneumonia shots in the fall going forward, and how that's going to get. I'm sure Greg and DIFTA have been thinking about that, and I know down here as well, but there's a concern, you know, that they cannot lose that access to those services. And they're going to, you know, I know a couple of programs in California where they have medical students going with home delivered meal folks and providing those COVID tests, for example, things of that nature. But I think we got to put our minds on how best to accomplish that before the season gets too far along.
Yeah, Bob's totally right. We just surveyed all the area agencies because they all hold flu clinics every year, and it's sporadic at best, very, very small number. And so that access is critically important as we go in. I mean, those things should be gearing up now. And so there has to be a whole different way to try to provide that access. You know, folks, a lot of our customers who are receiving core services don't want people that they don't know coming into their homes. So that adds an additional barrier on top of, you know, the public access where you get the community to gather. That's not going to happen this fall.
Mm-hmm. You know, along those lines, I mean, it's like, especially what you just said, Greg, about that older adults, I mean, it's like are much more likely to trust someone that they already know to help them get services, connect them to anything from groceries to messaging around health, getting flu shots, etc. And of course, you know, I'm thinking that, you know, in this audience, we have a lot of service providers, direct service providers, who, for not the majority, but for a certain sizable minority of older New Yorkers, I mean, it's like, are that trusted source. And so I'm thinking too, I mean, it's like, Bob, in a previous conversation, you shared with me that, you know, one of the ways that you were able to achieve support for older adult services in the emergency relief bills was by collecting stories from across the nation about how valuable those services are. And so maybe can you share a little bit of that story about, I mean, it's like how important sort of collecting those stories was to what you were up on the Hill?
What makes it unique in this environment is collecting stories in an emergency, meaning Congress is moving, except for the current moment, which we'll come back to later. In the passage of the first two bills, the Families First bill and the CARES bill, it was done with extraordinary speed for Washington terminology. And so if people knew you had contact with people on the ground, members of Congress and their staff would reach out to you and say, tell us what you're hearing, get some stories. And what you do is, as you pointed out, the Aging Network is the trusted entity in this country. It has been and will continue to be for years. The relationships have been built up for a period of time. They know exactly who's doing what and so on.
I'm on a call.
So that situation occurred so we could talk to service providers, but you could talk to older adults themselves and try to say, you know, give us what your concerns are going to be. Are you going to participate in the home delivery meal program? Are you going to have technology, et cetera? So I think, you know, gathering the stories, but having access to the people to give you the stories is just as important. And you have to do it quickly. I mean, we had some time deadlines that were unbelievable. And I worked on Capitol Hill for 17 years, never saw deadlines like this. You know, we need a number. We need a number to write in for, you know, funding for the nutrition program for the Older Americans Act. We need it by tonight. But we need some documentation to make the case for it. So happily, we're experienced. And happily, the network is experienced. And you can call state folks like Greg and the DIFTA folks and everybody else and providers and say, okay, we got this request. Once you say that, you know, Greg, you know that deal. We got this request from the Hill. We need some numbers. Boom, you get it, and it happens. And by the way, take a moment to thank Nita Lowey. Okay, Nita Lowey has done a remarkable job as the chairman of the House Appropriations Committee to make sure that adequate funding is done, you know, in a lot of different programs across the country, but always has her eye on New York. And I'm sorry she's leaving, but she's doing a great job right now.
And I'd like to just quickly follow up with what Bob said. In addition to Nita Lowey, Chuck Schumer, I mean, we worked with the governor's office to help get that $1 billion in the CARES Act. That brought $73 million to my office to go out directly to the area agencies and the network to provide the, those 5 services that I mentioned earlier that really rose to the top of the heap here. So Bob is exactly right. We're used to the drill of what do you need, how fast can you get it, how do you back it up. We're pretty seasoned at doing that, but New York carried the ball in helping the nation's older population.
Amen.
So I have to throw in, yes, but we still need so much more. The state is, my day hat includes being the finance chair for the New York State Senate. So I'm telling you, we are, depending on who you talk to, the governor, worst case, 15 billion deficit this year, 15 billion deficit next year, even if he's overinflating a bit, say 12 and 12, 24 billion over the 2 years. And the US Senate, and I'm not criticizing Chuck Schumer, but the US Senate has failed to even consider coming close to the proposal that the House passed in what's called the CARES Act. So the House would put $3 trillion into stimulus, and the states and the cities that are all so desperate. The Senate bill, actually the last one they talked about a couple of days ago, had 0 for states and cities. So we
that's
are.
What I called this, yeah, that's what I called the skinny bill.
Right, with less than skinny. And we're cutting programs now. You're right. If you are on the phone and Zoom, and you're a not-for-profit, you may have not gotten your contract renewed. You may have been told 20% of your budget is on hold. The governor hasn't actually cut, but I am advising everyone a delay months into a budget at some point actually becomes a cut, whether anyone ever calls it that or not. Greg would be in a much better place to explain what might be happening with contracts for seniors. Maybe they have been protected, unlike the other not-for-profits in health and human services that I've been talking to daily. I hope he's going to say, yes, Liz, they're not doing it to senior programs. But, we're in pretty desperate straits, and every single one of you can tell me about unmet need before the pandemic, skyrocketing unmet need during and likely after. And I'm going to tell you that best case scenario is we get back somehow with federal help to sort of the flat budget that we thought we might have for this year and next year. It's pretty scary times. So now, Greg, you want to tell them that nobody's cutting senior programs?
Yes, Liz, nobody is cutting senior programs.
Excellent.
Bobby's shaking her head. Maybe the city is, but the state is not. So I did not want my message to be that I was satisfied with the first 2 stimulus. At the time, that was exactly what we needed. It's going to carry us through. But to Senator's point, what we have now, regardless of the messaging from my office, which is we are exempt from that 20% reduction that other agencies are putting into place, and rightly so because of the types of services that we provide. But if we do not get a state and local assistance, not only for New York and across the country, the counties en masse do not believe that they are not going to have a reduction, not to mention they're not getting any tourism dollars, any tax dollars, all of those things that revolve around people working and economic activity. And so, I think we're more or less able to maintain a steady pace through this quarter. But I'm very, very concerned about what happens. And, given, the comment about, the Senate, nothing is going to happen until probably, we got to see what the election is. And then it's going to be January, which is really, really, it's beyond a shame. It's beyond a shame.
Let me interject one thought, if I could. You've got 2 things going on right now. You've got the failure to pass the 4th emergency bill, and you've got the fiscal year that ends on September 30th. And there is no appropriation bill ready to be signed into law. So once again, folks, you're dealing with the continuing resolution issue that you've had for years and years. Now, there is this outside hope, and it's pretty outside at the moment, that in this continuing resolution, it may not be just a straight bill. There may be things added onto it that are deemed more emergency nature than other things, okay? The hang up with Washington right now on the fourth stimulus bill is all about state and local aid. It's all about how big unemployment excess benefits should be, and raising the federal match under Medicaid, which the House bill did generously last time around. So the coming days are very important. And I'm sorry that it's the State Society on Aging of New York. I wish you could take State Society on Aging from Kentucky, from Texas, from South Dakota, and other places, and encourage them to lobby their members, their senators who are holding these bills up, because that's what it is. Senator Krueger is absolutely right. You know, this is not the place to follow the old adage about the Senate, where the Senate is the place where bills go to die. We don't want that here. We need these bills passed.
So I wanted to pivot as well. I mean, it's like, so I'm glad that you brought up, Senator, the fact that, you know, the Older Adult Services Network has been squeezed even before this pandemic. I mean, it's like, and now when the services are needed more than ever, there's this threat around the funding, and also much more broadly as well. I mean, it's like than the Older Adult Services Network. I wanted to pivot a little bit to a different piece that's also important. That is sort of the administrative changes that the pandemic actually necessitated. I mean, it's like, for instance, some services required paperwork to be signed in person, which is of course impractical. And of course, Greg, your office was integrally involved in pushing those administrative changes through. And Bob, you studied the effects of administrative changes on the provision of telemedicine services in particular, which of course has not just to do with OAA funded services, but also Medicare and Medicaid. So what effect have these changes had on service provision, you know, in telemedicine, older adult services, other places? And, you know, this is thinking to the future a little bit. I mean, it's like, is there any chance that some of the regulatory streamlining might persist even when in-person services return?
Well, I can start. The answer is yes on the second part. I think they're going to make a number of these things permanent because of the fact that they have been so well received and the participation rate has been good. But as Greg said earlier, and it's a very important point, you've got access issues that continue around the country for people getting into having the proper technology to do telemedicine. You know, upstate New York in particular, and places around the country. That's why, you know, there's a corresponding effort going on right now in the Federal Communications Commission to try to, you know, improve broadband coverage, places where it's weak. But, you know, they have to be done simultaneously. If you're going to make these things permanent and expand it, you know, you've got to make a strong commitment to have everybody have access.
And I'll agree that we've seen a lot of changes on the emergency level. And in New York State, we did quite a few of them through literally executive orders on an emergency basis. And I will tell you, as a legislator, the concept of the governor doing across the board emergency executive orders has been quite controversial, and we're getting some slapping around for giving him that level of authority. But in fact, I think if you take a look in the big picture, what we will see is the governor, through regulatory change and executive order, made a massive number of changes that are for the good. And what the legislature will likely do is to come up after the pandemic, sort through them, and say, these are really deserving of becoming statute so that they continue. Because the one thing about executive orders, they sunset depending on the date or whether a governor comes or goes, or whether somebody sues and says you overstep the boundary of statute. Statutes don't get moved overnight, or rarely do. So it would not have been realistic to imagine that endless quantities of emergency changes could have been moved through statute at the time frame we needed them done. But I do think there will be a reasonable approach to reviewing all and saying, these worked out really well, these should become the law of the state of New York. And some of the exact examples you gave around expansion of telemedicine, about the ability to do things without having to have a signature in person. I just learned the other day that I can have things notarized through the computer. Who knew? Well, apparently you can now. It's not even very complicated. You take a picture of yourself signing and you forward that to a notary with the document that you signed by scanning it into your computer, and then they notarize it and they send it back to you. Fascinating. So I mean, that's just one small example, but I was actually getting people talking to me about the legal nightmares that you couldn't actually get to a bank to notarize, you couldn't get to a lawyer to notarize, and yet there's a world of issues that still require you to notarize things. So I think there will be lots of changes. I know the Senate Democrats here in New York State have been hosting almost daily public hearings around different topics related to the pandemic. And the goal of those hearings has been to learn what's been going on in that specific subset field. What can we learn from people on the ground, people who are experts, not necessarily to try to point fingers and blame anyone. I mean, there's always some of that, but I don't find that particularly constructive at this moment in history, but rather to understand what worked, what didn't work, what we should be planning for and preparing for if round 2 or round 3 happens, or the next pandemic comes along. Because, not to depress you all, but this one's clearly correlated to climate change issues, and they're going to be more according to the public health specialists. So we have a lot that we need to learn from this set of nightmares so that we don't repeat them, or that we are better prepared the next time something comes around. And so that is why we're taking very seriously the public hearing model to try to learn and to try to come up with recommendations, be they in legislative recommendations or policy recommendations for the agencies, in order to not repeat the worst things that happened.
So Greg, I mean, it's, do you know, what are your thoughts around, you know, what you think is going to change in terms of the administrative side?
Yeah, so I mean, there's a lot to unpack in that question. I think we have to go back. You know, getting the federal disaster declaration was a godsend. Having an executive order that covered my agency that we wrote in language for was unbelievably helpful. We were able to, within the executive order, be deemed an essential service. Had to work with the Association of Counties to get that message down to the county executives because of the type of service provision that gets provided by this network. But it was made abundantly clear to me on day one that my job was to make sure that we served people and we would figure it out later. And I don't mean that loosely. There are things that we can put in place, and we did put in place to account for money, to be able to track what we were doing. But, you know, my message to not only my staff and to the network from the beginning of March is we are not going to get in the way of you doing what you need to do to serve people at the local level. And I got to be honest with you, I had more pushback inside than I did outside, only because it's out of the realm of folks thinking that we don't follow these things to the letter of the law. And I'll give you a kind of a silly example, but really illustrates, you know, the flexibility, how important that is. You know, we require public hearings every year for the plans that the counties submit to us that we approve, which then allows us to release federal and state dollars that they're abiding by, you know, fiduciary and program standards, et cetera, et cetera. And obviously, that's not something I'm going to authorize in the middle of a pandemic, is getting people together. What I learned through this is that the Offices for the Aging and the network became stars in their local emergency operations centers. They became go-to people for the health systems. We saved the health systems bacon through this pandemic, which is why I think we are, you know, we talk about funding and where we're going, et cetera. all the work that we've been doing to connect with health systems and PPSs and to integrate clinical services with social services has really accelerated immensely during this because of the role of the day-to-day things that the network did in providing basic needs, providing that support for telehealth visits. So we're having a lot of conversations with the Rebuild New York initiative that the governor put forward on how we do things differently in the future, which are very exciting. We're strategic planning with very large health providers throughout the state to talk about how we can get our folks in at the ground level and be equal partners and get paid for the services finally that have always been the heavy lift of the aging network that they take from the health system and don't get reimbursed for. So I think that there's a lot of opportunities, but your question immediately was, you know, when we go forward, are there things we should be looking at? And the answer to that is absolutely we should. You know, the models that we have were first developed in the 60s and 70s. There's been some modifications and some slow changes. This is an opportunity to really take a good look at what we did, you know, 6, 7, 8 months ago, what we need to do now going into the future. And we have a work group that we're developing to really begin to look at those types of things. And I'm glad to hear Senator Krueger, talk about that they're going to be looking at what worked and what didn't and making some statutory changes. Because I think that, you know, again, executive orders come and go. We have continued to get monthly extensions. Our executive order goes through October 5th. I expect that to continue, you know, month after month. But you know, we should always be evolving, and that's one of the hard things in the environment that we work in is you pass a law and sometimes it can sit there for 20 or 30 years with minimal to no changes. At least that's been my experience in aging, and this stuff should be evolving all the time because aging evolves all the time.
Okay. Well, thank you. I actually have one more question for you, and I'd like to tell everyone in the audience that it'll soon be time for your questions. So, think of some, sort of brief questions to ask our panelists. I also wanted to recognize Council Member Daniel Krupp, who joined us earlier. So thank you very much for joining us. So the last thing I wanted to ask you, so this is really looking at the future. I mean, what really needs to be in place in order for in-person services to older adults to resume?
A vaccine.
I'm going to agree, particularly for older New Yorkers and others who are considered high risk for a much worse bout with COVID. We need that vaccine, and we need to add to that, Greg, we need to convince 20 million New Yorkers not to fall into the trap of the anti-vaxxers and to recognize that this vaccine, when it gets here and when it is proven to be safe, not when Donald Trump announces on election day he's got one, that we need 20 million New Yorkers to take this vaccine. And we need 330 million Americans, or whatever number we actually are at, to take this vaccine. So this is going to be a multi-year challenge, even once the vaccine is made available. I know the Senate Democrats are committed to making sure that once available, the vaccine is free to everyone so that we do not fall into this, the haves and the do not haves for getting vaccinated. We're going to try to make sure that we broaden the criteria of who can give the vaccine, because we certainly don't want a story where people are still perhaps afraid to go to hospitals, but it's the hospitals giving out the vaccines, or you need to have a private doctor. We want to expand on successful models we already have in the state, that people who are physicians' assistants, nurse practitioners, pharmacists can all give the vaccine. Because when we expanded, by the way, vaccines to pharmacies and flu shots to pharmacies, we radically increased access to being able to get vaccines and flu shots. So I know sometimes the medical community struggles with the legislature thinking this is the right thing to do, but again, really are getting past this as quickly as possible and protecting older New Yorkers from being able to continue with lives outside their apartments, is trying to get as many of us vaccinated as soon as humanly possible.
And I'll just echo what they both said, and I would add on the vaccine part, let's have enough older adults be in clinical trials. That may serve as an encouragement for them to participate, like they're doing with Moderna, one of the companies that's in the lead, I guess, for a vaccine. But the other thing I'd say too, if we're going to be talking about reopening things that people went to, we need adequate supplies of personal protective equipment. It's absurd in the greatest country in the world that we don't have enough masks to go around for activities and programs. So those two things, I think, for sure, will help us get back to some semblance of the old order.
And
Right.
sorry, go ahead, Greg.
I just wanted to add, I was kind of flipping in that because that was the obvious thing is we need a vaccine, and all those points are correct. I don't want to leave with the assumption that we ever stop doing face-to-face, nor are we going to. I don't think that that's the right move. I don't think it's the healthy move. I think there's a prioritization to that. But when your average customer is an 83-year-old low-income female who lives alone, got 4+ chronic conditions and high level of functional impairments, there's going to need to be some eyes and boots on the ground to be the checker for, the eyes and ears for the doctor and the physician. So those things should not go away. It's just how do we balance all of these things with, knowing who's in the home or available for family support, those who are able to, virtually check in so you can do, a home assessment, you can look in the refrigerator, you can do some of those things remotely. But we should not be going away from the face-to-face. You want to minimize that as much as possible, but there's a lot of people at risk that need that. And again, in this type of environment, I'm very, very concerned about, older adults being taken advantage of financially and others because of all the other crap that's going on out there with, the stressors of, 20+ million people out of work and them being isolated and the increased alcohol and drug abuse, et cetera, et cetera.
Right. And that's something that I was going to go to as well. Just, of course, services as they've been, it's going to be difficult to get back to that for many obvious reasons. But in terms of in-person services that could look different from what has happened before, I mean, it's like, do you see any possibility of something like that happening? And of course, I'm thinking finding ways of reducing social isolation. I mean, it's like, is there some way that the Aging Services Network can perhaps partner? Perhaps, I mean, it's like, think of different ways of doing their work.
Yeah, and I think that that's already in place. And, some of the things were happening over the summer where it's easier to get outside. I'm concerned now going into winter, right? So, I mean, there were places that were still gathering people, but you could do exercise classes outside and have space and distance and do things like that. And those kinds of things were happening as people were learning over the summer. Once we buckle down and, especially in, upstate New York earlier on September, it's not unheard of that there's going to be snow in September, October. And then as we move into, the November through March area, it's going to be very, very difficult. And I think, the folks who are on the Zoom meeting and those who will listen to it afterwards, this is what people have been grappling with. So, our role is to kind of share what some of those things are that are happening, figure out ways to make them happen, use our flexibility and our dollars to purchase things or to do things differently, which we have the flexibility to do. But I'm going to be heavily reliant on the service network providers to be offering us advice, not only in what works and what doesn't work, but we have to rethink our entire lens in terms of our federal ask, what the Older Americans Act looks like, what the state budget looks like, to address these things we never had to address before.
Right. Okay. Any final comments before we move right to questions? Right.
I have a comment. Can you hear me?
Yeah, Beverly, I just wanted to say something really quick to everyone. I mean,
Sure.
It's like we'll be glad to start with you. So just, as Beverly has done now, I mean, it's like just ask a question, just unmute yourself. And then once you're done, just mute yourself again, because, there's about 70 of you on the call. And, if we start receiving noise from every corner of the state, it's going to be a little chaotic. So just unmute yourself, ask the question, and then unmute yourself. And Beverly, go ahead.
Thank you. As many of you know, I'm an occupational therapist as well as a social worker. Occupational therapists were surprised in April, I believe. We received an email from the governor's office, all of us, pull the license numbers, saying that we were frontline workers and asking us to contact them so that we would be working basically in hospitals with COVID patients. Many of my colleagues did so. That is something that, as an OT educator, I have not been telling our students that we were frontline workers. So what I'm thinking about is adding, I don't know if social work was considered frontline workers because I didn't get an email from New York State asking me to work as a social worker. I got the email asking me to work as an OT. So in terms of having to, making home visits and whatever, there's a model already in place. And if we need that for the fall, depending on how bad things are, I wonder if that's a way to get folks making visits to the most vulnerable individuals to prevent what could be catastrophes, especially in upstate New York.
I don't know what the licensing rules are for occupational therapists versus social workers. But if it was an executive order, maybe Greg's in a better position to follow up for us and see how it was written and what categories it might still apply to. I don't know, Greg, do you think you can dig into that?
Yeah, I mean, the executive orders I can certainly send them out. Hi, Beverly. Your first comment was, I can't really talk about the OT and how that related to the hospitals. Your second one is important. I'd love to see what you have. We've put out quite a bit of guidance on already several months ago in terms of the protocols to follow for, senior centers. All of those decisions are local. There was never any order from the governor to close a senior center or to close NYSOFA funded social adult day. Those were decisions made at the local level by county executives, public health departments, and those reopenings will follow the same pattern. But in terms of in-home visits and many of the things that we provide, transportation, PC, et cetera, there's been a mountain of guidance put out that follow many of the same protocols that we've all been living for the last couple of months. But I would love to see what you have to see if we've missed anything and we could add to that. Because I think, again, the more good info that we get out there in terms of how to deal with this safely so that we're protecting, individual, family, community is going to be important.
Hi, can I ask it's hard
Sure.
to jump in. Thank you.
And also, Bobby, I mean, just like Beverly did, I mean, it's like make sure that you and everyone else identify themselves just so we know who you are.
Okay. Hi, my name is Bobby Sackman. I'm now working with the New York Caring Majority Coalition. And just quick, just to piggyback on what we're talking about, yes, we should have guidance for home visits, but we need to recognize that there are thousands of people waiting for case management under ISEP. My understanding in the city is that, if the number's correct, I saw it in an article, it was almost 3,000 people or something. We also have massive Medicaid cuts, which is impacting home care and nursing home care. And I know we have some home care providers on this call. One piece of the question is, did the $73 million you received, which is obviously good news, did any of that go to ISEP? Where did that money go? And also, I know we don't have DOH on this call, but I think there's a broader picture here of what's going on for frail seniors. And I don't know if we could address any of it.
Yeah, so I think, hey, Bobby, I know that the lexicon in New York is to talk about ISEP. We have a much larger in-home program than just ISEP. ISEP is the state-funded version. We case manage 70,000 people, serve 15,000 people with PC 1 and 2 every year. As you know, we've gotten $30 million over the last 2 years to eliminate the 17-18 unmet need data. We just finished surveying the area agencies last week, so that data is coming in to look at where we are in the current stage. It's always a snapshot in time. So in addition to, the $500 million this network through our office provide service. And that doesn't include, as you know, towns and municipalities and CAP agencies and faith-based organizations, but just those that are connected to us. In addition to everything else that they, provide, they were able to use those dollars, all the federal titles and all the state titles, for anything that they needed at the local level. And they determined that, not me. So the 5 key things that rose to the top, and this doesn't mean that there wasn't others, because of course, PC 1 and 2 and case management, all of those things are important. And if that was a need locally, that's what they did. If it wasn't, then it wasn't. The number one thing was home delivered meals. These are not in any order. Grocery and supply delivery, transportation to, dialysis, cancer, and other critical appointments, combating social isolation, and prescription drug delivery. So in addition to the 25 plus core services that are provided to 1.3 million people through our office and the network every year, that's where those dollars go. We will have a much better idea in the coming months because, again, as people were sent home, as people were working remotely, as the volunteer base went down, the ability to enter data into the system obviously takes a little bit more time. So we don't know exactly where all of those things went, but those were obviously, regardless of where you were in the state, those were the top 5 things. So the long answer to that is, yeah, of course it was used for those services.
So I wanted to jump in actually, because we were having this discussion. Can you, and this is for the 3 of you, I mean, can you break down a little bit how decisions are made in terms of how this federal funding, where the federal funding ends up going? I mean, I know that some of the decisions are at your office, Greg, but for much of the rest of the funding, I mean, what does that decision tree actually look like?
So I'm sorry, if Congress has actually made specific requirements for how the money is spent, then it has to be used for those purposes. And there's been quite a bit of earmarking in the federal definitions. And if it's just money related to COVID coming to the state of New York, the buck stops with the governor. Sorry, Greg.
Yeah, so we were different. So that's not how it worked for us. I think we were the only agency that I'm aware of, and Bob can correct me. The money came right here, and it goes, and how it was designated is the way that it's always designated. But I really want to give a shout out to Kathleen Oddie and ACL. We worked very hard to secure other dollars in other areas. So we were able to, because of Westchester raising an issue to me, we were able to get $50 million in HUD carved out to be able to provide meals and other support services in HUD buildings. We worked very hard to make sure that the ADRC money that both went directly to the ILCs but also came to our agency was able to be used to provide services to the younger disabled that might not have been connected to Medicaid or OPWDD or some other system. But the dollars that came right in here go out by formula, as they always do. I can't designate, there's a higher need here, a higher need there. It goes out by formula. State funding goes out the same way. And so, we receive those awards. We put out a 25% advance, and then it's voucher-based after that. But we did that immediately earlier on so that, the counties were ripe with cash. We wanted them to spend those dollars first so that, they, depending on what happened over the course of the year, and now D-Day is coming in terms of, the ability of the state and county governments to continue their commitment, that they would have the money that they would need it up front. Now, I have to tell you, as one final point, and I'd be interested in Bob's feedback on this, the counties in New York State are a significant contributor, including DIFT at the city level, because they're the one big AAA, provide way more money for the services than the state and the federal government. And so, the impact of this virus on their ability to raise revenue through all of their various sources is going to have a really large impact. We were luckily able to get a legal ruling that you could not use federal stimulus money to supplant state or local dollars, but many of the counties are overmatched, meaning, they provide way more than what they're required to under the law. And that's the concern going in to the fall, as many are being asked to, prepare contingency plans, which they should, of 15, 20, 25% reductions based on, what they're hearing at the state level.
The other thing I would add, 2 things. One is the emergency money under the Older Americans Act, as Greg well knows, also took away a lot of restrictions. So in other words, you can transfer dollars throughout Title III versus before, you had limitations on transfers between nutrition and supportive services. Now you can do unlimited transfers throughout Title III, which is important for a lot of areas based on their needs. And on the second point, Greg, I think, that's the crying reason for why we need state and local aid in an emergency bill. You cannot have that outside the picture of consideration. And I think at the end of the day, in typical Washington fashion, you're gonna have two sets of numbers. Somebody's gonna have 3 trillion, somebody's gonna have 1 trillion. They'll come out with 2 trillion. Hope it comes out the best way. But that's where the individual advocacy for how you prioritize that money becomes very important. And I cannot imagine a United States senator who does not have local government concerns in their state that needs to have that thing addressed. So eventually, I think it works itself out. But I'll try not to be too much of a Pollyanna here right now.
Mm-hmm. Mm-hmm.
And I've been hoping the same as Bob, and he's absolutely right. The federal designation was critically important. We have a variety of federal titles, and I'm not going to go through them all. But, a clear example of how this works is if you had $100, for example, and you need to spend 20 in 3B and 20 in C1 and 20 in C2 and 20 in 3D, that's not how it worked. We had $100 now. And you could use that any way you wanted to meet any need for anybody over the age of 60. And that type of flexibility is huge because what might be happening in the city may not be what's happening in Clinton County and Chautauqua County and Otsego County. And again, that's the beauty of the network is it's not top down, it's grassroots, bottom up to be able to meet those needs. And who better to make those decisions than the community itself?
And I want you to know, Greg, we're already starting the process of trying to carry those waivers into FY21 funding too, when that process comes. So.
Right. So I mean,
Perfect.
It's one of those ways in which those dollars are even more valuable because it's a flexible dollar, as opposed to, it's like being designated into each of these sections, and localities or local providers can really more directly hew to the needs of their own communities. So absolutely, that's a really important point.
Christian.
Yeah. Hi, James.
Hi, James O'Neill, UN Representative, International Federation on Aging. We all know, and each of the speakers indicated that getting a vaccine and actually taking the vaccine is going to be very important in helping to stem the pandemic that we're all involved in. Most of us know that most Black and brown people, and especially older Black and brown people, know about the Tuskegee experiment, and it affects many things that happen in their lives. And as a result, they are not part of the testing nor the taking of many types of vaccines or flu shots because of what happened with the Tuskegee experiment. What plans have been made or are being made to try to successfully include Black and brown older people in both the trial and actual taking of the COVID-19 vaccine?
James, I think your question is perfect. Speaking for myself, I don't think I know enough about how trials are done for vaccines to know the answer. And I will tell you that I think the right answer for supporting outreach and education to older Black and brown New Yorkers once we have a vaccine is to coordinate with respected community leaders and organizations to get people to understand the minimal risk compared to the maximum advantage. I know when I worked in the late 80s and 90s with the AIDS advocacy world, it was critical to have people in every community talking about the disease and how one avoided the disease. And I know that while sometimes it was tough, but getting into the churches in communities of color was a critical way to help to educate people around that disease. And there have been various models used by New York City's Department of Public Health to support and educate people around why they shouldn't be fearful of vaccines and why they should not be fearful of flu shots, etc. So I think you follow on good models of community participation and community-driven education, the same way that it has worked, perhaps not perfectly, but more effectively than simply top-down announcing, and the governor and the mayor and the president say, go out and everyone get their vaccine tomorrow. I think we know we have to do more. Maybe Christian wants to have another Zoom where he has some of the public health and epidemiological folks come to speak specifically about that. I know I did a town hall with a WHO vaccine expert from London talking about the concerns and issues of getting the world to take vaccine. I think your question is, exactly right. I'm just not sure, not criticizing either of my other speakers. I'm not sure any of us are really experts in the field.
James, I will say this. I have seen some stuff come into my computer this morning, actually, on that very topic. A very strong letter by some of the national minority groups, National Minority Quality Forum. Some other folks are pressing very hard on that point. And I know that some of the pharmaceutical companies are a little bit more responsive to this issue than they had been. So let me share with you what I have this morning, and just show you some of the things that are being done that I can see.
Thank you very much, Bob.
Good to see you, my friend.
Same here.
Hi, James. I'd just like to add, I mean, what you referenced was already mistrust based on past experience. And I think, Senator Krueger is exactly right. When we get to a place where it is safe, that is what's going to happen. I think where we are now is we have a very, very large credibility problem at the national level. And I am hopeful, at least, in listening to, our state, is that all of the material and the science and the studies will be heavily scrutinized before we endorse anything here, so that we know that it is safe. We've got 6 billion people on the planet. This is a huge jackpot for whoever gets there first. There's no question about that. And everybody's, rushing to help, no doubt. But this is a big moneymaker for the pharmaceutical companies. So I share your concern. And I think that, once the science is deemed and the studies are deemed appropriate and these are safe and they're tested and there's a rigorous review of that data, then we need to really gather everybody together from all the communities to be able to get the word out that it is safe.
Hi, this is Jackie here on the beach, Senior Research Director at Department for the Aging in the city. And James, I just wanted to reach out as well, because I've been inundated by all the medical centers reaching out to the Department for the Aging, specifically about getting older adults, especially of color, to participate in clinical trials. I'm on an advisory committee with NYU, and I actually have a grant right now with NYU specifically to try to encourage people, not necessarily simply with COVID, but just in general, because it is a broader issue. So it is something that the city's been involved with and acknowledging and, and working with. So I just wanted to let you know.
Thanks, Jackie.
Christian, I saw Ruth had her hand up, I think, but I'm not sure. Did I see that right, Ruth?
Well,
yes.
Ruth, okay, go ahead.
There we are.
Oh, you were on the other screen.
So I was thinking about sort of blending together a couple of the resource opportunities and problems that we've heard, specifically really pleased to hear, Greg, what you're saying about the responses to the pandemic leading to more integration between the Aging Services Network and healthcare providers. This is, of course, a thing everybody's been working on for years and years, but kind of flinging themselves at it without enormous success. And I think that if we could scaffold the immediate need for flu and pneumonia vaccination to the longer term education and then participation needs for COVID vaccines as sort of a urgent imperative that is shared between those systems, we might make, and then with that flexible money available at the federal level combined with the willingness to invest on the part of pharmaceutical companies, because this is, they're going to make, whoever wins makes money, just as Bob said. Maybe we could build some bridges that we could walk over for other reasons when this is done. And I was sort of wondering how we can help you strategize and make those kinds of relationships and start building some of that into guidance and law and so forth. It just seems like this is such a terrible thing, and there's so few opportunities to help the Black and brown and poor communities that are the most affected via the structures that we have. And that seems like one. How can we use it?
Oh, I'm not sure who you were directing it to, but.
Well, Greg, maybe most.
Yeah, I thought so. Okay, cool.
Yeah, I think, I'd like to have a follow-up with you, because I think that there's been some natural connections where there's really been a recognition of, the things that we have been working on for so long that we have not been able to move the ball on, that really came out in this pandemic, as you talked about. I mean, the connection between the alcohol and substance abuse providers, physical health providers, and then mental health providers, and then the wraparound with the aging network. We have some really good stuff working with Haney's and the Healthcare Association on age-friendly hospitals, and how that intersects with our age-friendly work and our prevention agenda and overall public health. Some of the other things that I had mentioned earlier on. So I'd love to strategize with you a little bit more, because I think a lot of it's connecting the dots. A lot of it's relationships that don't exist that do need to exist. And I find, as I become more confident in talking to the clinical network, I know we have what they need. And once we tell them, then they know that we have what they need too. And we can work together, row in the same direction, not duplicate, and really serve people holistically from a person-centered way. And so I'm really optimistic that, the best of the aging network is to come, and that there are going to be financial supports that are going to accompany the great work that came out of COVID, because we were able to respond the way that we did.
Okay, to be continued.
Yeah, so thank you very much, Ruth, for your question. And so I just wanted to point out we're almost at time, and I know the senator has to duck out because she has another place to go. So I just wanted to thank you, Senator, and all of you. Really, I mean, it's like for your questions, for being here, for being such excellent panelists, for having such great information as always. So I really hope that you all enjoyed this. So thank you very, very much. I also wanted to point out that we have one more event coming up this week. So certainly check that out. I mean, it's an event around palliative care and older adults. And so that's being hosted by a fellow board member, Mary Beth Morrissey, and Melissa Lang. So please check that out. That's on our website, which again is ssany.org. So again, thank you to you all for joining us, and hope to see you soon. Yeah, even if it's virtually. Take care.
Thanks, everybody. Stay safe.
Yep. Thanks, Annette.